Welcome back to the front porch. I mentioned earlier in our program how U.S. News ranks Wake Forest Baptist one of the top area hospitals in the nation. And we're excited to find out more and more about why the people around the country rank us so high. And the fact that right here, Lexington Medical Center is part of that wonderful award. And right now we've got Dr. Brandon Chapman. Dr. Chapman, now you are eyes, ears, nose, throat specialist.
I am an ear, nose, and throat specialist, minus the eyes. And we also, our specialty is actually called otolaryngology. That's why we say ENT.
It's what?
Otolaryngology.
Oh, you scared me there for a minute. Okay. Now, ears, nose, throat, what all do you have to look at?
So we treat ears, noses, and throats, which is what most people know us by, but we also treat head and neck is our specialty. So we treat things outside of those three things we mentioned earlier, such as malignancies of the neck, so cancers in the neck that have spread to the lymph nodes in the neck, thyroid disease. So thyroid cancer is a very prominent condition, and we treat a lot of thyroid cancer. And then we also do things such as facial plastic surgery. It's not something we're well known for, but about a fifth of our training as otolaryngologists is spent in facial plastic surgery. And locally, what that will equate to is that we treat a lot of facial skin cancers and things like that you don't want to just have removed and have a big scar. So we're trained in special little local flaps we can do to the face for cosmesis.
Wow.
So it's a little in addition to the normal things we're known for, such as just tubes and tonsils and things like that.
That's good to know. I mean, that's turnkey service, start to finish. I want to get more into that, but first of all, you got a kind of a hometown connection. Your wife is from this area.
That's correct. My wife, Jennifer, was Hughes was her maiden name, and grew up in Silver Valley. She has lots of family in the Silver Valley, Denton area, and she's actually been practicing here in Davidson County as a family medicine physician assistant now for over 5 years. She's in her 6th year of practice.
And she's still working in here.
She still is. She is at North Davidson Center for Family Health, part of the LexMed system, and has been there since I've been here in my training. And
so you kind of got to behave yourself.
I do. She knows everybody around here. So
all right, now your office. Your office is on West Medical Park Drive, right over here in the center, and you take appointments and referrals from other doctors. If somebody has a particular condition, what would they have? You know, I better call Dr. Chapman. What are some of the things they might call you about?
It's a huge hodgepodge of the things we treat. Obviously, the common things such as chronic ear infections, ear disease, hearing loss is a big thing in this area with all the industry. Nasal diseases such as, obviously, we all know about sinusitis, and I treat a lot of chronic sinusitis, nasal obstruction, difficulty breathing, sleep apnea, recurrent infections of the throat, tonsillitis. So those are the kind of the bread and butter things, and there's the things we mentioned earlier, such as head and neck cancer, which we'll be working with the Cancer Center of Davidson County to hopefully manage more of that locally, and then the other things such as thyroid disease and things like that we'll be treating here.
So if somebody needs, if there's any cavity or anything above the shoulders and there's a problem, more or less your office is ready to handle it.
More or less, with the caveat that we're not neurosurgeons, so we don't work on the brain, and we also are not ophthalmologists, so we don't treat the eyes. And way back in history, we did treat eyes as well, but we have so many other things to focus on. The ophthalmologists have taken that over primarily.
Since you've been in practice here, what are some of the more interesting things that you've sort of noticed or found? I know probably, according to the time of year, it's been sinus infections.
Sure. Sinusitis is a huge problem in this area. We're known as the kind of the allergy capital of the country in this part of North Carolina. So allergies and sinusitis are a huge thing that we treat here, and I've noticed that the population down here definitely has a significantly larger amount of that than I'm used to.
All right, I'm not going to ask you anything else. I'm not going to ask you anything else about brain or plastic surgery, but can I trade for some advertising? Because I may need some little. We'll talk about that later. All right, Doctor, you get referrals from other physicians if somebody
Correct.
has a particular problem. If somebody's watching, go, well, you know, I've got a thing in my ear, or I've got a back of my throat. Should they call your office?
They certainly can. Traditionally, it's been that the primary care has to make that referral, and it really depends on their individual insurance company. But a lot of the companies now are letting patients self-refer themselves, so they certainly can call the office, and we can process their insurance and decide if they need to have their primary care physician make that referral, which usually is a fairly easy step that we can even call for.
All right, now, you've already told us you're a full-service office, but if somebody comes in with a particular problem, you still have the resources of a wide system.
Exactly, and that's what was so enticing to me taking this position. I have a faculty appointment at Wake Forest, and I actually spend half a day a week teaching residents. So I have that interaction both with the residents, and I just came from a faculty meeting at Wake Forest with our overall Department of Otolaryngology faculty. So I have them at my disposal if there's something complicated, or if there's certain things that we're not capable of managing here from an acuity standpoint, or something that needs other specialists, such as a neurosurgeon involved. We have a very easy way to initially evaluate patients here, maybe start the process and get them in our system already, and to see the appropriate one of my partners that specializes in any certain area.
Wow. So if I need my adenoids out to lower my voice and I need a brain transplant, you can take care of one and refer the other.
You got it. You got it, Willie.
That's always good news. This is just another outstanding example of how Wake Forest marriage here with Lexington Medical Center is beneficial to everybody.
Exactly.
And we are sure glad that you're here, Doctor. I really am.
Thank you.
I'm serious about some of this work I may need. Hey, keep watching. We got more surprises for you coming up. Dr. Chapman, good to see you. Always good to see you. He's got to go around the mic and his coffee cup. We got our new tables here from Tradewind Treasure, so Willie won't spill his coffee. But keep watching. More coming up right here on the front porch.